Allergies are the sixth leading cause of chronic disease in the United States. About 55% of the population in the U.S. tests positive for at least one allergen. Allergy diseases affect as many as 40 to 50 million Americans. That's 1 in every 5 people. While allergies are most common in children and young adults, allergies can manifest in the senior population as well. Many times, allergies in the elderly are misdiagnosed and therefore mistreated. That's why it's so important to understand the symptoms and what causes allergies. Here to educate us about allergy prevention and treatment is family practitioner Dr. Thiele with Baptist Medical Group. Thank you for being here.
Thank you.
Well, it's certainly the perfect season to have you here with us today. I think everybody's suffering to some degree. Tell us a little bit about what is going on this particular year. We were talking a little bit before we went on the air.
Well, right now with the change in seasons, we get a lot of pollination. You could probably see it on your car, for example. That's the thick yellow coat. Also, with the change in season, we have change in different types of grasses, trees, weeds. And with all the changes that go on, it really triggers a lot of people as far as runny nose, chronic cough.
So what are some of the symptoms that tell us this is not a cold or flu, but it really is a seasonal allergy?
Well, the key is the duration. If you start looking at over a couple weeks, then you might be dealing with an allergy component for sure.
What if somebody has not had allergies before? Is this something that they can get at any point during life?
Certainly. Absolutely.
Well, can you give us some steps that we can do to prevent it? I mean, nobody wants to suffer through it or share it with other people. What are some things we can do to help prevent allergies?
Well, the goal is really to take simple steps. And one of the best simple steps that I've found is with the pollination, the change in grasses, trees, weeds, the number one step is avoidance of the allergen. Shoes, let's say that you wear outside, really should not be worn inside the house because the pollen can get caught in the carpets, on the furniture. So sometimes just, let's say, to go buy a cheap pair of slippers to wear in the house is really ideal.
Okay.
Another great step is, now that we're going to start running the air conditioner soon, would be to change the filter. That is one of the biggest steps as well. That would be number 2. And when you do change the filters, a pearl to that is to spend a little extra money and get one of the filters that is designed for allergies. The filters that have the thin blue kind of mesh,
right.
they really don't work. They really don't trap much. And with the size of the pollen, really does not do much.
So the blue ones kind of look like fiberglass, where you can see through, almost see through them actually.
That's
so you're
correct.
Saying like the ones that have like the white, almost a cloth.
Right, and a ridge kind of pattern to it as well.
Okay. Now what about on some of these days where it's not quite as hot and we want to say, well, let's just open the windows. Maybe we've had some high electric bills this winter and want to try to balance that out. Is that a good thing to do though?
Well, you also have to look first at the weather pattern. When it's been several days without rain, that pollination kind of just stagnates in this area as far as almost like an attic type of effect, especially in the Panhandle area. So maybe 1 to 2 days after some type of rain, that may not be a bad idea.
Okay. Well, what are some common allergens that you've noticed in this area?
The biggest one is mold, especially being near the ocean and the humidity. Basically, that would be number 1. Number 2, we're looking more or less dust mites, specifically with mattresses.
Well, back to mold, is this something that is just normal, you know, in the bathroom shower area, or is this other types of mold? What type of mold actually? I mean, where is it coming from? I
Both
guess?
Indoor and outdoor. For the most part, indoor, the showers are a big culprit. So just a simple solution to spray down the showers can make a big difference.
And what about dust mites? Where do they come from?
Well, they like to live in bedding. Specifically old mattresses, old pillows. I recommend you change your pillows every 6 months. Also, a nice cheap way to go about things is you can actually buy a cover for the mattress that'll kind of hold the dust mites, contain them, in other words.
What about pets? Pets are great, but they do go in and out, and they do like to sleep on the pillows or jump up on the bed occasionally. What about pets?
Well, for the most part, the rule that I like to tell my patients is if you're not sure whether let's say the cat or dog is a possible trigger for your allergies, then keep the dog or cat out of the bedroom at night. And also you could buy a HEPA filter, which would help trap some of the dander and stuff that might get.
What is that? Expand upon that if you don't mind.
As far as the
thing you just mentioned that they might want to purchase?
Yes, a HEPA filter. What it does is basically it's an ultrafine filter that traps some of the allergen particles that get in the air. And they're not too expensive. And for a bedroom, you really don't need one of the expensive ones. Mm-hmm. You can get away with one of the cheaper Walmart type of brand.
Okay. Well, are there certain patients that seem to have more complications, and can this lead to other issues as well?
Certainly. We have to worry about our asthmatics, especially the ones that are on long-term medications, mm-hmm. and also with any cardiac history. Reason being is when this time of year rolls around and we have the pollination, it's essential that we teach our asthmatics to make sure they're using their inhalers properly and also that they're compliant with their medications.
So can this cause some pretty big complications?
Certainly.
Well, what about treatment? Whether it's something that they would actually get from their doctor, or now you go to the drugstore or the pharmacy and there's just tons of, there's D, there's no D, there's non-drowsy, there's drowsy. What do you advise?
That's an excellent question, because some of the over-the-counter medications, you really have to read your labels on what's in the medication. For example, some of the cold preparations that are out there, if you have a history of any kind of heart disease, let's say hypertension, you don't want to be taking a medication that has Sudafed in it. And at the same token, some of the over-the-counter nasal sprays, for example, let's say Afrin. Using Afrin or any over-the-counter nasal dilator, what will happen is if you use that more than 2 to 3 days, it can actually cause a rebound effect and make your symptoms worse. So really the goal is to stick with some of the old-fashioned medications. You certainly have your medication, for example, Benadryl, which is sedating in nature, which may not be a good idea if you're working, of course, or driving. Right. But some of your non-sedating antihistamines, both over-the-counter and prescription, can do an excellent job.
Great information, Mark.
Yes.
Thanks for being here, and we hope everybody stays well this spring.
Thank you.